My name is Melissa Moore, and this is my 2020 Capstone project presentation. My presentation and my project was centered around improving the care of our patients through proper IV pump cleaning. Too far. So the basis of my project was that on my unit in the ICU, pumps were regularly being cleaned by our housekeepers, but there was nothing signaling that they had been clean, especially if they had been left in patient rooms. Also, there was no identifier that the inside of these pumps had been clean, which is considered a high-touch area. And in 2018, our hospital policy had established that it was the registered nurses' jobs on each unit to not only clean the outside of the pump, but to clean the inside, to properly mark that these pumps had been cleaned, and to properly store them in the clean storage unit. We wanted to establish a system set up that there was easy access for nurses to have the cleaning supplies that they needed, the labeling supplies that they needed, and the proper education that they needed to ensure that we were having improved patient care and patient outcomes through this project idea. So prior to the installation of this project, like I mentioned, housekeeping was doing a majority of the cleaning of our IV pumps, and things were being missed as we did an inspection of our unit, inventory as such, to see how many of our central brains and how many connectors we had on the unit. We discovered pumps that had old dried blood on them, caps and things in empty rooms where patients had been discharged, as well as just kind of dust and dirt on the inside of these pumps. So along with our inventory, where we found that the ICU has 40 central brains and 100 of the channel collectors, we took a survey of the nurses in the intensive care to see if they knew of the hospital policy, and knew what their role was to be with regards to the proper cleaning and storage of our IV pumps when they are not in use with a patient. The results of that survey show that 35% of our nurses knew that the policy was that it was their job, yet many admitted to leaving that up to housekeeping. So getting from that baseline understanding, we knew that this project would rely on the integrity of our nurses to be willing to make some adjustments to their daily routine, especially when they discharged patients from the unit. The benefits that this can have to our intensive care unit is to decrease the number of hospital-acquired infections and minimize the risk of infection overall. Several studies were done, and I found several studies throughout this project and the completion of it that showed these high-touch areas, which include IV pumps, are 66% about infected with common illnesses and diseases that are easily spreadable. Specific to my ICU unit, we were noticing a jump in our central line acquired bloodstream infections, and we were hoping that with the proper cleaning and care for these IV pumps, not only on discharged patients, but patients who are actively in the hospital, if we just did daily cleaning, we could start to decrease those infections that we were noticing. Let's see, what's my last one? And then we wanted to make sure that all the nurses were aware that it was their duty to participate and ensure that this cleaning was being accomplished. So I selected my preceptor, Shelly. She has really been kind of my support person through my first year of nursing. She oriented me to the unit. She has frequently brought up things that can be improved on this unit, and from what I could tell, she was somebody who really cared about our patients and wanted to help improve their stay, improve their outcomes, and just improve the overall environment in our intensive care unit. She has been a nurse for over 6 years and has worked on this specific unit in both respects as a CNA and as a nurse for about 15 years. Her professionalism and just her overall desire is really what made me want to pick her as my preceptor and mentor for this project. The goals that we set in place for this plan was to improve our patient outcomes and decrease hospital-acquired infections and the central line acquired bloodstream infections. As we can see from our study right here, an estimated 75,000 deaths occur because of hospital-acquired infections. And as I mentioned before, the study showed that several infections and infectious diseases were found on high-touch areas, including IV pumps. So that was our major goal, is to improve those and to see a decrease of infectious diseases found on our pumps. We wanted to provide a clear and proper sanitization list and instructions that would be easily visible and accessible throughout the unit. And then we set up a goal to organize and develop an area in our clean supply or utility closet where the cleaning supplies would be easily found and kept, as well as an extra set of instructions for the proper cleaning of our IV pumps outside and inside. The analysis of this project, I met with my mentor, I met with our infectious disease nurse, I met with housekeeping, and all 4 of us met and established the directions that we wanted for the proper cleaning of our IV pumps. We made a list of the supplies that would be needed, and then my mentor and myself, we cleaned up an area on my unit in that clean utility closet, organized these supplies, and then posted the instructions for cleaning IV pumps in each room so that nurses could easily find them. Due to COVID-19, the timeline was adjusted a little bit due to the scheduling conflicts of my mentor and, again, like our infectious disease nurse who's been super busy, as well as our housekeeping. So we were able to come up with the final draft of our instructions. We were able to print out labels that identify the pump as being cleaned. That way, if it does by chance get left in a discharged patient room, there's something signifying that has been cleaned other than just being placed in our clean supply closet where they typically are stored. And then we set up the survey. One of the speed bumps we also hit was that prior to COVID-19 hitting, we were supposed to switch our IV pump system over, and this did not occur until like a week before we were doing our final checks and final swabs of the pumps. Something I forgot to mention earlier was that prior to implementation of this new cleaning method, we were swabbing all of our pumps to see what infectious diseases were present. So the switching of pumps a week before we were going to do our final swab did impact those results a bit. We did take swabs of the Alaris pumps prior to them being switched out, and then we also took swabs of our newer Biberon pumps at the end of this trial period. So over the nearly 2 months of this project being in place, our unit did see a decreased number in hospital-acquired infections, as well as we started to see our decrease in our central line-acquired bloodstream infections as well. Like I said, our lab was great in helping us to take swabs and samples of our pumps prior to the implementation of this new cleaning method and post, both on our older pumps and our newer pumps, to see that we were maintaining with our new pumps what we had established with the old ones. Again, we completed the survey of the nurses at the end of our trial period. From that survey, they reported positively to the simplicity and the easy access of the supplies and the instructions that were placed in each room. A concern that was brought up that is valid and we need to continue to address is how to ensure that these pumps are being sanitized during busy times of the shift. It's not always easy for a nurse to step away from what she's doing to what she or he is doing to sanitize pumps, especially if there's a code or something else going on. It is an intensive care unit, so it can be very busy. It definitely unified us as nurses as well, getting us all on the same page of what the expectations of us are and how we can better reach those expectations. Not only that, but we have also become very aware of the high touch areas. Even those have been seeing better cleaning and better maintenance by the nurses just as the day goes on. Little tidying here and there has been seen since the start of this project. In conclusion, our high touch areas such as IV pumps again are one of the leading causes of hospital acquired infections. So with the help of my mentor, we were able to input the sanitation plan to decrease these infections and improve patient outcomes. We used supplies and we had easy access to our supplies. We used the purple wipes, and then our housekeeping, they didn't give me very many specifics on the disinfectant solution that they had, but they had the microfiber towels, and they mentioned that it's 2 minutes for the purple wipes, 10 minutes of sitting with the disinfectant solution to ensure proper sanitization of these things. We increased nurse compliance to hospital policy. This project really helped me to embrace my leadership skills in that being a newer nurse to the unit, I don't speak up a lot about concerns that I see. This gave me that opportunity, and it showed me that when I'm bold and confident in my plans, that I can speak up and help improve patient care, and the nurses around me are willing to listen. Overall, for my future in nursing, it has taught me that I can grow and experience strength in acting upon things that I see. I definitely see something, say something, and that has improved drastically for me. I am grateful that I had this chance to do this project, to embrace leadership skills, and to see those improved patient outcomes on my unit in the intensive care. And that was my project. Thank you.